Just quickly, the comment you made yesterday on the vaccine and the mandate, do you regret that?
Sorry, which comments are you talking about?
Sorry, my apologies. On Sunday you made the comment about the vaccine mandate. Ultimately, it was not mandated. Vaccines were not mandated. Do you stand by that? There was no compulsory vaccination.
That is not the word that I used. I said nobody was forced to be vaccinated.
There was no compulsory vaccination. People made their own choices, quote unquote.
There was no compulsory vaccination. People made their own choices.
That is correct, Mike. There were some people needed to be vaccinated to do some jobs, but no one was made to be vaccinated.
So you would stand. All I'm asking for the record, you would stand by. So the person, for example, who made the choice not to get vaccinated, lost their business and laid people off. That's on them, not you.
Well, they made a choice.
What will the ramifications be for teachers or those in the health workforce who choose not to be vaccinated?
Ultimately, in the health workforce, they will not be able to work in those roles.
But no one was made to be vaccinated.
In the education workforce, from next year, they won't be able to work in those roles.
Well, they made a choice.
Ultimately, in the health workforce, they will not be able to work in those roles. In the education workforce, from next year, they won't be able to work in those roles.
There was no compulsory vaccination. People made their own choices. In terms of the vaccine mandates, I acknowledge that it was a challenging time for people, but they ultimately made their own choices. There was no compulsory vaccination. People made their own choices.
Nobody was forced to have a vaccine. I believe everybody was offered an opportunity to get a vaccine or not get a vaccine. I don't believe that anybody was forced to take a vaccine.
It's going to be like, well, it's almost like, you probably don't see it like this, the two different classes of people. If you're vaccinated or if you're unvaccinated, you have all these rights. If you are vaccinated...
That is what it is, so, yep.
My home, you took my business! Because I didn't take an injection. How fair is that? Now you want our votes? Screw you, Chris Hipkins. Treason. Treason. They're going to be... My home and my business gone because I didn't take an injection. How fair is that? I took my home and my business because I didn't comply to these rules. Everything was taken away from me. Calm down. All my staff lost their jobs. How can you be calm? How can you be?
Any kind of value in looking into potential compensation for anyone, disadvantaged through COVID, whether they were mandated out of their jobs or injured by the vaccination program?
There's a process for people who are injured in a medical procedure. There's already processes in place for dealing with that. In terms of the vaccine mandates, I acknowledge that it was a challenging time for people, but they ultimately made their own choices. There was no compulsory vaccination. People made their own choices. In terms of the vaccine mandates, I acknowledge that it was a challenging time for people, but they ultimately made their own choices. There was no compulsory vaccination. People made their own choices. There was no compulsory vaccination. People made their own choices.
Is any of that going to be included in the inquiry that's going on at the moment around COVID? Is it going to look at any of those issues?
The Royal Commission can look at whatever it wants in regard to the COVID response.
So it could potentially look at how many fit been injured, how many were mandated out, and potential compensation for them. That could be looked at.
Well, ultimately, it's a Royal Commission, so it's not my job to direct them. Other than they have a terms of reference which everybody can see, and it's certainly not my job to instruct them what they do within that terms of reference.
Early next year, we'll be in the phase of chasing up people who haven't come forward to get their vaccination or have missed their bookings and so on. So everyone will be able to get a vaccine between now and the end of the year. But of course, and I want every New Zealander to come forward. But human behaviour suggests that there will be some people that we have to actually really go out and look for, and some of that may spill into next year. But our commitment is everyone will have the opportunity to get the vaccine by the end of the year. Everyone will, but I can't say that that we're not going to have some hesitant people or some people who just haven't come forward that we don't have to go out and find next year. Everyone will, but I can't say that that we're not going to have some hesitant people or some people who just haven't come forward that we don't have to go out and find next year. That's going to be down to New Zealanders. If New Zealanders come forward and get their vaccinations, and we don't have to chase people, if we find that people aren't coming forward and we have to go out and chase people, then that's one of the things that will slow this down.
Health and education staff are among those who had to be let go because of the mandates.
And the District Health Board has lost close to 100 healthcare workers because of the vaccine mandate. More than 100 teachers have also lost their jobs.
Thousands of workers at businesses like bars, gyms and hairdressers will have to get the jab to keep their job under a vaccine mandate just announced by the government. Vaccination will be required for all workers at firms where customers need to show vaccine certificates, like hospitality and close contact businesses. There'll be a new law to make it clearer for employers to decide which types of jobs require a vaccine. Non-vaccinated workers in those roles will be given a new 4-week notice to get the jab or lose their job.
We're working to make it as clear and as simple as possible about when it is reasonable for an employer to require vaccination as a condition of employment. This law change will require a minimum of 4 weeks paid notice for any employee who loses their job because they are not vaccinated.
Cabinet has decided today that vaccinations will be mandated.
Once the notice period commences, the employee will have that amount of time to get vaccinated. The employee will be able to retain their employment if they get vaccinated in that period, but their employment will be terminated if they do not.
Government is planning to require every single teacher at every level and all support staff who work with children to be vaccinated.
News Hub can reveal the mandate Chris Hipkins is taking to Cabinet on Monday is a mighty big stick. Every educator who works with a child will have to be vaccinated.
I can now confirm that we'll be extending this requirement to large parts of our health and education workforces as well. Cabinet's agreed that high-risk workers in the health and disability sector will need to be fully vaccinated by the 1st of December. This includes general practitioners, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units. We'll also be including certain non-regulated healthcare workforces, including aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations that provide health services. Schools and early learning staff and the support people who work with them, who have contact with children and students, will need to be fully vaccinated by the 1st of January 2022. That includes home-based educators, all those who support people in our schools and early learning services such as teacher aides, administration and maintenance staff, and contractors. Secondary schools in Kura will also be required to keep a COVID-19 vaccination register of their students. Students that don't produce evidence of vaccination will be considered unvaccinated.
What will the ramifications be for teachers or those in the health workforce who choose not to be vaccinated?
Ultimately, in the health workforce, they will not be able to work in those roles. In the education workforce, from next year, they won't be able to work in those roles.
There was no compulsory vaccination. People made their own choices. There was no compulsory vaccination. People made their own choices.
Last week I announced that the education and the health and disability workforces will be required to be vaccinated to help prevent the spread of COVID-19. This follows on from the government's earlier decisions for workers in our MIQ facilities, our airports and our ports to be vaccinated. We can't leave anything to chance, and that's why we've made the very difficult decision to make the vaccinations for people undertaking those roles mandatory. Anyone conducting high-risk work in the health and disability sector to be fully vaccinated by the 1st of December 2021. Under these new requirements, GPs, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units, must receive their first dose of the vaccine by the 30th of October. These requirements also include certain non-regulated healthcare work, such as aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations who provide health services.
There was no compulsory vaccination. People made their own choices.
Has he been provided with advice from officials on the impact of the Yardley and Minister for Workplace Relations and Safety High Court decision on the legality of other vaccine mandates imposed by the government? If so, what does the advice say?
Mr Speaker, without getting into the specifics of the legal advice that has been provided to the government, it is important to note that the Yardley decision, when read in totality, was actually a very narrow decision and cannot be applied to other vaccination mandate decisions. Vaccination, the use of vaccination requirements for certain workforces is something that the government keeps under review. As I've previously indicated, it is possible that some workforces will find those requirements removed before others. Many of the workforces covered by the vaccination requirements, so for people to continue to do those jobs they needed to be vaccinated, are in the public sector. There was no compulsory vaccination. People made their own choices.
You must have been fully aware that people, nurses, doctors, people to have their jobs, to keep their jobs, were forced to have the vaccination.
Senator, no, I believe firmly that nobody was forced to have a vaccine. I believe everybody was offered an opportunity to get a vaccine or not get a vaccine. I don't believe that anybody was forced to take a vaccine.
The forced COVID vaccination era in New Zealand must and should go down as one of the worst cases of mass injustice in the country's history. People were unquestionably forced to have COVID vaccinations against their wishes, and so many people who lost their homes and their livelihoods should be compensated. Furthermore, several high-ranking politicians and academics should also be prosecuted for a wide range of deliberate public dishonesty, including charges of manslaughter. Thank you for listening. WhangāreiTim.